Hey everyone, Justin White here, CEO and founder of Senior Health Services. We've got a Medicare flash on some news that came out last week that I thought we'd come and talk to you about. If you've been watching the news, you've seen an item that's come through saying the Part D subsidies from the government are being sunset at the end of 2026, and that is true. They were supposed to be sunset at the end of 27, but they're being discontinued at the end of this year. Now, to start this, I want to let you know what they were for and why they were put in place in the first place. Back in 2022, the Biden Inflation Reduction Act was passed, and that did a lot of things, among which was to renovate Part D drugs, to put a cap over the costs of these drugs after a certain point, and to also cut costs in the drug plans, mainly for the feds, and put it back on the backs of the insurance companies. That's what that was designed to do, and that's exactly what it has started to do, and a big chunk of those changes went into effect in January of 2025. Well, in the run-up to 25, back in the summer of 24, that's when the insurance companies put the bids in on what the drug plans are going to look like for the coming year. Well, when those bids started coming back, and the powers that be in an election year, go figure, right, saw the size of the premium increases that were going to come through that year, they said, you know what, this is what I'm told, we can't do that. We have got to soften this a little bit because that's going to cause some problems. So the government created what's called a demonstration program. That usually means they're going to throw money at something. And in this case, it happened to be subsidies at the prescription drug plan before it had even gone into effect. These changes by the Inflation Reduction Act. So they're kind of bailing it out before it even happened. And it was to smooth over the rate increases to make them less dramatic. And that is indeed what happened. A lot of companies participated, some did not, but it did make it a little smoother to where the premiums didn't just conk up immediately. They came up a little bit slower, okay? Like the subsidies, don't like the subsidies. It seems a little weird to me to bail out a law before it even goes into effect, but that's essentially what happened in layman's terms. So fast forward, why are they taking them away? Well, the current administration looked at them and made the determination that based on the bids that they saw this summer, that the industry seems to be doing okay in managing those plans now that we're a couple of years into this thing. And so they basically said, we don't think the subsidies are necessary anymore. And, you know, not only do we don't need them through 2027, we can go ahead and end them at the end of 26 to stop that spending that they ended up deeming unnecessary. And so that's what that is basically. So the result of that is going to be some modest rate increases on the prescription drug plans. Now, these are their words, not mine. And I heard the estimates where they said some plans could see as much as a $20 per month jump in premiums. Now, those are probably going to be the plans that have higher premiums. We will see when the bids and stuff come out. But they did say that most of the plans are not going to jump that much. It'll be less than 20, with the vast majority of which being under $10 a month in increases. And then they did say that some of them may actually go down. I don't know about that. We'll see. But bottom line is they did deem that the plans could be operated now without the assistance of the subsidies. So that is the quick question. If you got any follow-ups to that, or you don't understand it, or wondering about something else, please feel free to give us a call at Senior Health Services, 281-894-7540. We will help you. We'll help you for free. Thank you so much for watching, and we'll catch you next time.